So on this video, I want to talk about the surgery I had to remove my cyst, the laparoscopy procedure I had done. So I was telling y'all how I got a sonogram which found the cyst. So I had a pelvic and transvaginal sonogram. So with the pelvic one, they just used they just found it from the outside of my abdomen, and then that's when I had to drink the bottles of water, and they moved around because they said it's easier to see when you have water in your bladder, I guess. And then they let me use the restroom, and then I came back, and then I did the transvaginal one where they actually put the tool inside of you and did it that way. So they found that the cyst, and that I had abnormal uterine bleeding. So they found the cyst. There was like a smaller cyst on I think it was on my right ovary, and on my left ovary there was a larger one. The larger one was like almost 6 centimeters, they said, and then the smaller one was only like 1 centimeter. So they did 2 sonograms, and the second one they said that it wasn't getting any smaller, so they wanted to do the surgery. So they said that the cyst could it was like it had, what they say, it had some solid components to the cyst, and she was like it could be hair, teeth, and stuff like that on the cyst. I was like, ew, I don't want that on me anyway. So that's when they decided that they wanted to go ahead and do the procedure. So I'll talk about the day before. So the day before, they told me don't eat or drink anything after midnight. They told me that I needed to shower with this. I don't want to say the name wrong, but this. So I had to shower the night before, and then the morning before the surgery with that, to clean the area that they were going to be working on. Then I had to drink a bottle of magnesium citrate. If you know about that stuff, that cleans like everything in there. It cleans everything in there. Like, I was still cleaning myself the next morning. I started drinking that around 6 p.m. the night before. I was still relieving myself the next morning. That stuff ain't no joke. It's really not. So I did that the day before. Then the day of the surgery, I really wasn't that scared or nervous, because I've had scoliosis surgery before. I have scoliosis, and I had spinal fusion surgery. So I feel like after that surgery, this little thing is not. So I wasn't really nervous or feel for anything like that. But they said no jewelry. So I had to take out my belly ring. I had to take out all my piercings. I was afraid of the belly ring. I didn't want it to close up. But when I got to the hospital, the lady, she was trying to get the IV in me, and she couldn't get it in, and I hate needles. Like, she couldn't. It was just, that was the part I was nervous for. But when I got in the hospital bed, I felt like that magnesium citrate was working again. I was like, oh my God, I was scared I was going to use it in that bed. So my cousin was trying to help me. She was like, do you want to hurry up and run to the bathroom real quick? Or you want to? I was like, I'm afraid if I run to the bathroom, I'm going to use it on my way there. But I don't want to use it in the bed. So I was like, I don't know what I want to do. So I went to the restroom, and I didn't even have to use it. So that made me mad. So that day I had to bring a pillow, so that after I would have to put the pillow on my way home, I could put the pillow right there so the seatbelt wouldn't like hurt me or anything like that. So the procedure involves, they will they make a small incision under your belly button. They put a camera in there. They fill your stomach up with carbon dioxide gas so they can see better depending on, so they use the camera to see where the cysts are. Depending on where they're at, they may make more smaller incisions to get to it. So they remove it. They remove the cysts with some other tools, and then after, when they collect the cyst, they send it to a lab to see if it's cancerous. So they also took pictures and gave me pictures. That's disgusting. And they found that there was tattoo ink under my skin, and well, with my scoliosis surgery, I wasn't supposed to be getting tattoos. So my granny was like, I told you can get them tattoos. You ain't supposed to be getting tattoos, and now you got tattoo ink under your skin. So she was really upset about that. She was getting on me about that. I'm like, well, that didn't have anything to do with surgery. Y'all didn't have to tell her that part. But yeah, she was getting on me about that. But so they took pictures. I did see the tattoo ink under my skin. That was nasty. But the cyst looked pretty big. It was like a golf ball size. So that was disgusting. And then after I woke up, my stomach felt extra like bloated from that gas. So they told me to buy some Gas X. Well, they told me to do that before because I already knew. Told me to buy some Gas X. I had a sore throat from the tube that they put down my throat, so I couldn't like really eat anything that was not like liquid form. So it really hurt to swallow it anyways. So then they prescribed me tramadol, 50 milligrams of tramadol, and they also prescribed me ibuprofen, 800 milligrams of ibuprofen. So I had to take that whenever I was in pain. They told me no intercourse to at least 2 weeks after. No traveling beyond 2 hours for at least 2 weeks. Let me make sure I'm not missing anything. Yeah, the pictures are pretty disgusting, and I don't think it's appropriate for me to show that on here. So, yeah, that's nasty. Then there was a 2 weeks post-cert that I had to do a follow-up to make sure there was no infections or anything like that. So it's like having another freaking yearly exam thing with my OGYN. So I had to do that. They put glue instead of stitches, so I had glue, and she started like ripping the extra glue off, which hurt. Oh my God, that hurt so bad. And I had to do a urine test, and then when I did the urine test, at first they told me that they saw it was abnormal or something. That scared the mess out of me. But then I did another one that said it's fine. So I don't know what happened with that. But then they told me the cysts were not cancerous, so that was good. And then yeah, that was pretty much it for the surgery. So I have my appointment, my yearly exam on not next week, but the next week. So I'm gonna do next week. So I'm gonna do my next video on my yearly exam. I'm gonna get off birth control. I'm gonna ask her how long after you get off of the pill should you start trying to conceive again, and then how long, if I haven't gotten pregnant yet, should I come back to her and maybe ask for a fertility specialist or a referral to a fertility specialist. So I'm gonna do that, and I will tell y'all how that one goes. So tune in to my next video.